I'm Natalia from UNES Public Health Science Department. In this video, I would like to explain about anaplasmosis. It is one of the examples of rickettsia zoonosis. So let's get started. Anaplasmosis is a disease caused by the bacterium Anaplasma phagocytophilum. These bacteria are spread to people by tick bites, primarily from the black-legged tick and the western black-legged tick. The transmission are from tick bites and blood transfusion. Anaplasma phagocytophilum is primarily spread to people by the bite of an infected tick, and in rare cases, Anaplasma phagocytophilum has been spread by blood transfusion. Signs and symptoms of anaplasmosis typically begin within 1 until 2nd week after the bite of an infected tick. Tick bites are usually painless, and many people do not remember being bitten. See healthcare provider if you became ill after having been bitten by a tick or having been in the woods or in areas with high brush where ticks commonly live. The early signs and symptoms are usually mild or moderate and may include fever, chills, severe headache, muscle aches, nausea, vomiting, diarrhea, and loss of appetite. Rarely, if treatment is delayed or if there are other medical conditions present, anaplasmosis can cause severe illness. Prompt treatment can reduce your risk of developing severe illness. Signs and symptoms of severe illness can include respiratory failure, bleeding problems, organ failure, and death. There are 3 risk factors for severe illness: delayed treatment, age, which is being older, and weakened immune system, because people with weakened immune systems, such as those receiving some cancer treatments, individuals with advanced HIV infection, prior organ transplants, or people taking some medications, are at risk for severe illness. Healthcare provider can order certain blood tests to look for evidence of anaplasmosis or other illnesses that cause similar symptoms. Test results may take several weeks. If your healthcare provider thinks you have anaplasmosis or another tick-borne infection, he or she may prescribe antibiotics while you wait for the test result. Early treatment with the antibiotic doxycycline can prevent death and severe illness. Doxycycline is the recommended antibiotic treatment for anaplasmosis in adults and children of all ages. There is no vaccine to prevent anaplasmosis. Prevent illness by preventing tick bites, preventing ticks on your pets, and preventing ticks in your yard. Ticks live in grassy, brushy, or wooded areas, or even on animals, so spending time outside camping, gardening, or hunting will bring you in close contact with ticks. Ticks can be active year-round, but ticks are most active during warmer months, or April until September. Before you go outdoors, you have to know where to expect ticks. Ticks live in grassy, brushy, or wooded areas, or even on animals. Spending time outside walking your dog, camping, gardening, or hunting could bring you in close contact with ticks. Treat clothing and gear with products containing 0.5% permethrin. Permethrin can be used to treat boots, clothing, and camping gear and remain protective through several washings. Alternatively, you can buy permethrin-treated clothing and gear. Avoid contact with ticks. Avoid wooded and brushy areas with high grass and leaf litter. Walk in the center of trails. After you come indoors, check your clothing for ticks. Ticks may be carried into the house on clothing. Any ticks that are found should be removed. Tumble dry clothes in a dryer on high heat for 10 minutes to kill ticks on dry clothing after you come indoors. If the clothes are damp, additional time may be needed. If the clothes require washing first, hot water is recommended. Cold and medium temperature water will not kill ticks. Examine gear and pets. Ticks can ride into the home on clothing and pets. They attach to a person later. So carefully examine pets, coats, and day bags. Shower soon after being outdoors. Showering within 2 hours of coming indoors has been shown to reduce your risk of getting Lyme disease and may be effective in reducing the risk of other tick-borne diseases. Showering may help wash off unattached ticks, and it is a good opportunity to do a tick check. Check your body for ticks after being outdoors. Conduct a full body check upon return from potentially tick-infested areas, including your own backyard. Use a handheld or full-length mirror to view all parts of your body. Check these parts of your body and your child's body for ticks. Under the arms, in and around the ears, inside belly button, back of the knees, in and around the hair, between the legs, and around the waist. And that's all my explanation about anaplasmosis. I hope you find this video helpful. Stay healthy and happy. Thank you.